Attendees are in listen-only mode.
Hello, my name is Brittany Kabinski and I want to welcome everyone. It is now 1 p.m. so we will begin our presentation shortly. Today on Friday, June 8th, we will have our presentation on Federal Tools for Aging and Livable Communities given by Regina Gray and Ben Metcalf. For help during today's webcast, please feel free to type your questions in the chat box found in the webinar toolbar to the right of your screen or call 1-800-263-6317. For content questions, please feel free to type those in the questions box and we will be able to answer those at the end of the presentation during the question and answer session. Here's a list of the sponsoring chapters, divisions, and universities. I would like to thank all of the participating chapters, divisions, and universities for making these webcasts possible. As you can see, we have quite a few webcasts coming up in the next few months. If you'd like to register for any of these upcoming webcasts, please visit www.utah-apa.org/webcast and register for your webcast of choice. We're also offering some distance education webcasts to help you get your ethics or law credits. These webcasts are available to view at www.utah-apa.org/webcast-archive. And you can follow the instructions listed on the web page to log your distance education CM credits. You can also follow us on Twitter at Planning Webcast or like us on Facebook, Planning Webcast Series, to receive up-to-date information on the Planning Webcast Series sponsored by chapters, divisions, and universities. And to log your CM credits for attending today's webcast, please go to www.planning.org/CM, select today's date, which is Friday, June 8th, and then select today's webcast, which is Federal Tools for Aging and Livable Communities. This webcast is available for 1.5 CM credits. We are also recording today's webcast, and it will be available along with a PDF of the presentation at www.utah-apa.org/webcast-archive. And at this time, I would like to introduce our moderator for today, Ramona Molahay, who will introduce our speakers for today, Regina Gray and Benjamin Metcalf.
Good morning and good afternoon. This is Ramona Molahay, this webinar is being sponsored by the APA Private Practice Division, and here's the Private Practice Division website, and I'm the past chair for the Private Practice Division. One of the things that we want to mention is that we have also sponsored March 16th webinar that looked at the federal tools coming from the US EPA's Aging-Friendly Communities model. As you know, the American Planning Association has identified that one of the major issues for planners is planning for a dynamic population. The aging of the baby boomers and the aging tsunami is really key in regards to one of the major issues that we as planners face. As you know, 1946 to 1964 is really considered the baby boomer generation, and we're looking at 76 million of them. And as of the year 2011, January 1st, the first baby boomer turned 65. And according to the Pew Research Center, over 10,000 baby boomers will reach the age of 65 daily. What that really tells us is that we have seniors that will be increasing dramatically in regards to the population between 2010 and 2030. And after that, it will be projected to slow down from a high of 18 to 20% of the population. So one of the initiatives that the Division Council has identified is this Aging and Livable Communities. And the key goal is really taking a look at how planners can create the plans and policies that really address livability and are age-friendly for all. So one of the things that we're doing in regards to that are divisions and chapters are getting together and collaborating in regards to developing a robust website and web pages that really address aging and livable communities so that it can be used as an online database. Because we all agree that planners are really fundamental to the transformation of our communities. So here are some really basic resources for those of you who are just embarking on the initiative. The Older Americans 2010 is being updated currently. Aging in Place is an excellent resource. It talks about a survey of all the states in regards to the livability policies and practices. Housing in an Aging Population, Are We Prepared is really an excellent resource that just came out by the Center for Housing Policy. And of course, EPA puts out a monthly e-newsletter and listserv on aging and sustainability that really covers a whole lot of resources, including publications, grants, conferences, issues. And of course, everyone knows that the World Health Organization has a self-assessment tool that's a real basic checklist on essential features, what they call essential features for age-friendly cities, that might be useful for you as a starting point. So we know that housing and sustainability and livability are vital to communities, especially for the senior and aging demographic. So today's webinar is really going to focus on HUD and its efforts and cross-changing collaborations that are ongoing to really address the living options, services, and sustainability for an aging population. Today's presenters are Ben Medcalf and Regina Gray. Ben Medcalf is the Senior Advisor to the Acting FHA Commissioner and the Assistant Secretary for Housing, and his background is pretty phenomenal in multifamily housing programs. He really focuses on choice neighborhoods, Section 202's supportive housing for elderly program, and the Section 811 supportive housing for persons with disabilities program in HUD. And he's also the lead on the rental policy working group, which is an alignment initiative out of the White House. And it's in partnership with the Departments of Treasury and Agriculture. And his background comes from bridge housing and also as common ground communities. Regina Gray is the program coordinator and research analyst for the Sustainable Communities Research Office of Policy Development and Research for HUD. Her research activities have focused on sustainable development, urban design and land use planning, and TODs, energy and green building practices, and affordable housing preservation. She is also closely aligning some of these areas with the Obama administration's sustainability goals, and she collaborates with other federal agencies on a host of sustainability initiatives, including the FTA, DHHS, which is Health and Human Services, CDC, and the White House Interagency Task Force addressing childhood obesity. So it is really my pleasure to start off with Ben Medcalf. Ben?
Hi, good morning, good afternoon. Thank you, Ramona, and thank you, everybody, for making the time this afternoon to talk about what is unarguably a very, very important topic. As Ramona alluded to, I've been working on elderly housing issues here at HUD for the last few years. And had a little bit of an opportunity to experience directly some of the policy changes that are going on now to make our housing more effective. And as Ramona said, I do come at this work from the perspective of a practitioner and from somebody who has spent most of his career working on actual projects in actual communities, trying to think about how to house elderly persons better in the communities in which they're already living. What I want to talk about, though, in the next few minutes is really a very bird's-eye view of some of the things the federal government is doing in the space of elderly housing, particularly elderly housing with services, and give you a little bit of the context on where I think the landscape may go in terms of federal investments over the next few years. First, I'd like to just start very quickly, really by echoing Ramona's demographic observation, which is just a compelling need for us all to be very thoughtful about the aging population. We do have a huge demographic bubble that's coming, and it's particularly pronounced on the older population. What's tricky and why the housing piece, I think, is so centrally important is the rent burden that older renters face. Almost half of renters 62 and over are paying more than half their income in rent. This rental crisis, affordability crisis, just ends up being particularly pronounced for the elderly cohort, and that's really a consequence of a couple of factors. One is stagnating incomes. The other has, particularly over the last decade, been increasing rents and increasing utility costs. The rent burden and affordability issue becomes particularly compounded for elderly individuals because of disabilities and assistance with activities of daily living that they need on a day-to-day basis. And so as of 2009, almost 1 million or a third very low-income elderly renters have worst-case housing needs, paying 50% more of their income in rent. And by 2020, there will be 1.3 million elderly requiring assistance with activities of daily living, and an additional cohort, same number, that have cognitive or physical disabilities. But what we do know is that even in the face of this demographic bubble and these real challenges, that elderly individuals again and again state their personal preference of being that they want to continue to live in the community, that they want to stay in place and continue to stay generally in the same home that they've already been living in. In terms of what HUD does today, much of it is focused around providing deeply affordable rental housing. HUD provides ongoing deep rental assistance to approximately 5 million households all across the country. These are subsidies that generally make housing affordable so that households don't need to pay no more than 30% of their income in rent, despite whatever the market rent may be where they live in the current housing situation. Of that approximately 5 million, a significant number are for the elderly. Approximately 1 million, in fact, is for project-based assistance. So this is assistance that goes through actual physical properties that serve the elderly. Our Section 202 program, which is really our flagship program for elderly households, serves about 130,000. Our project-based Section 8 program serves 430,000 households. And public housing serves 325,000. That's just HUD. In addition, housing subsidies flow to the federal government through the United States Department of Agriculture, the Rural Housing Branch, as well as low-income housing tax credits administered by the Department of the Treasury and state housing finance agencies. Low-income housing tax credit program in particular actually has more units on the ground today than the entire public housing inventory does. And what you see is that across all of these programs, if you look at the project-based stock, you do see elderly individuals overrepresented relative to their size in the stock of HUD-assisted and federally assisted housing. And we would argue that that's a good thing, but it's not good enough. HUD programs are serving only a fraction of the total number of elderly folks who would benefit from this assistance, folks that are low income and that are rent burdened, which is to say paying more than 30% or more than 50% of their income in rent. Approximately, that number is about, HUD serves approximately 1 in 4 of all renters that are rent burdened in this way, and among elderly it's slightly better, it's about 1 in 3. But that means that for every 3 elderly folks who really would benefit significantly from an affordable rental option, 2 are currently not accessing HUD or federally assisted housing. And then the other challenge that really drives a lot of the work that we do at HUD is what we call preservation, which is to say maintaining and protecting that federal inventory, that historic federal investment into these assets. Much of the housing stock that is affordable to the elderly, certainly on the project-based Section 8 and the public housing, it goes back decades. These are the huge legacies that were left by past generations in terms of building this housing stock. And what we see is that a lot of this housing is going away, and that either property owners who have been benefiting from contracts are choosing to opt out of those contracts as they come to an end and reposition the properties to market, or some of this housing has become functionally obsolete or has capital needs that are simply not financeable. And so whether it's a public housing agency or a property owner, decisions are being made to exit the program and to remove that stock housing from the inventory. And so when you think about that in the context of all the elderly folks living in those homes, a compelling picture begins to emerge for the need for HUD to be working on improving preservation options. So of all that HUD investments, HUD in particular is really only funding rental assistance. So again, it's making up the difference between what an elderly person can afford to pay and what the actual market rent is. And while this is hugely helpful because it frees up income to go for other health-related purposes, it in and of itself does not necessarily mean that seniors are able to access services. And increasingly our focus here at HUD is to think about how we can make sure that the folks living in our buildings in particular are able to access the services they need to age in place. And one factor in particular that's worth noting that's really driving our efforts to be very collaborative and very creative, frankly, is the fiscal crisis which we find ourselves in. A lot of, all of you are aware of the challenges that Washington has had to pass budgets in recent years. A lot of that is driven by the desire to reduce the deficits and to reduce overall government spending. And much of the burden for reducing that spending, it does end up falling on non-discretionary defense spending, which represents actually a very small share of the overall budget. Where the biggest opportunities are to create savings for the taxpayers arguably is going to be on the healthcare side of the budget, and a lot of those entitlement programs, Medicare and Medicaid. And one of the things that's been motivating a lot of our work at HUD has been trying to think about how tactical and low-cost investments to support our elderly that are living in existing HUD-assisted housing can actually defer or obviate the need for much more expensive expenditures paid by state and federal governments under Medicare and Medicaid. And one of the very exciting things really about this administration was its commitment from day one here at HUD to really embracing the idea that housing, although useful in and of itself, is also critical as what we call a platform for improving quality of life, which is to say that HUD has really been doing a lot of thinking about how we can place our housing investments really at the service of other investments and see housing as a means to an end, less of an end in and of itself. So in terms of the preservation piece, let me just give you two examples of the kind of work that we're doing, which I think are important for you all. One is the rental assistance demonstration, which we're just rolling out right now. Literally, we have a notice that will be getting published over the next few weeks detailing this new authority. But the public housing inventory in particular suffers from a severe capital backlog, about $25 billion of deferred capital costs. And we, under the Rental Assistance Administration, have new authority that have been given to us by Congress to begin to help public housing authorities reposition those units and recapitalize and rehabilitate them. Effectively, what the Rental Assistance Administration does is it allows us to shift the financing structure that currently supports these units over to a different kind of financing platform, over to the Section 8 platform. This allows for public housing authorities effectively to lock in for their properties long-term assistance contracts at fixed rates, and effectively to begin to do much more easily to leverage, but by that I mean to take on long-term mortgages to access private capital to make those repairs and amortize the cost of those initial investments against long-term rental contracts that they can now benefit from. It also, the Rental Assistance Administration also importantly not only allows PHAs to access private mortgages on their properties, it also allows them to better access the low-income housing tax credit program, which today is the primary source of new capital for affordable housing. Another example of what we're doing is the senior preservation rental assistance contracts. Many of the housing stock, much of the housing stock that was funded under the early generation of the Section 202 program only provided for subsidized loans for properties as an inducement to get owners to make them available for elderly folks at very low rents. And what's been happening, we've seen more and more, is that as the terms of those loans actually come to conclude, these were in many cases 30-year loans, and it's now been almost 30 years since those loans originally originated. Owners don't have a way to refinance, to deal with their capital needs, to keep those properties affordable. in large part because the renters themselves have not been able to take advantage of rental assistance contracts. So by very tactically providing new rental assistance contracts into this property, we can preserve the stock for the long run and keep it affordable and keep very, very poor elderly residents in their homes. So that's the preservation piece. Then as you start to think about what we can do more in supportive housing and aging in place, what's motivating us there is really the idea that what we're trying to build in housing with services is something that's very clearly an alternative to institutionalization. Housing that really is situated in the community, that really is focused on independent living, but that keeps elderly folks from accessing much more expensive institutional settings that are not desirable from a quality of life perspective, nor from a taxpayer investment perspective. And much of that work is fueled by changes in healthcare, that both coming out of the last decade with a huge expansion of, for example, the Medicaid waiver, which is also called the Home and Community-Based Service Program, and also changes that are coming up through the Affordable Care Act, which make it much easier to deliver these services, really long-term services supports directly into the community. Now, these can go, in theory, really to elderly folks wherever they live. They don't necessarily need to be in affordable HUD-assisted housing. But HUD-affordable assisted housing actually does sometimes offer opportunities for the service providers because they do provide some economies of scale, because there may be clusters of elderly folks within a particular building that can benefit from a similar package of services. And what we do see is that with a relatively light touch, our housing can really have the potential to create a lot of savings. And one study, for example, done by the American Association of Service Coordinators actually estimated the cost of providing subsidized housing plus having an in-house service coordinator. This is somebody who does what the job title suggests, really just coordinate services, but because that person is effectively connecting residents to the kinds of services that they might otherwise simply not take advantage of and end up in a nursing home, huge savings are possible. And so at the federal level, we've really been exploring what the opportunities are for doing that. Very early on, our Secretary Donovan, and Secretary of Department of Health and Human Services, Secretary Sebelius, decided to create an actual partnership around this, to really explore at a very high level what the opportunity set was for formally delivering some of the HHS services in tandem with some of the housing investments. We were very pleased just a few weeks ago to see a lot of our work formalized through a new Office of Community Living that was created within the Department of Health and Human Services, whose sole mandate is really to think about how we can keep disabled and elderly individuals living in the community, and how we can make sure that having elderly folks integrated into the community and having disabled folks integrated into mainstream society is fully achievable in the country that we live in today, and that in effect, no individual should need to go into an institutional setting if they do not want to. And I will defer much of this discussion on the joint HUD-HHS data matching study to our next presenter, Regina, who can talk about this. But also motivating us is just some incredible breakthroughs that are on the cusp that involve data matching. And while this doesn't sound like the most exciting thing to many of you, it really has the potential to pretty fundamentally reform where the federal government is putting its investments. We have almost at our fingertips now an ability to reconcile the huge data that is collected at HUD on its residents with the data that is collected by Health and Human Services in terms of Medicaid and Medicare expenditures. And what that will allow us to do is really, first of all, to begin to see where the potentials are for savings, where light touch interventions on the housing side may be able to offset huge costs on the healthcare side. And one study in particular that HHS produced, which is really telling, is that although when you look at the demographics of who accesses Medicaid and Medicare, there are a lot of parties who access it in some form or another. The parties who are the greatest expenders of that are overwhelmingly persons with disabilities and elderly persons. And even within that subset, if you look just at the top 5% of individuals who are spending healthcare, you see that accounts for 48%, almost half of total health spending is basically coming out of a very narrow band of individuals. So these are individuals that we may be able, through some very targeted interventions in the front end, we may be able to save significant funds in the back end for federal government and for state governments who contribute much of the Medicaid funds. And again, some more studies that motivate our work. HUD has been investing over the years in a service coordinator program, so we actually provide some very small amount of housing money to actually embed into our large properties somebody whose job it is, again, simply to coordinate service delivery and help be a kind of a broker or a matchmaker between the folks living in the building and the service providers in the community who can address the needs that they're experiencing. And what's very exciting about this study that came out in 2008 was that it actually could tell a difference. You could actually look at properties that had service coordinators versus those that didn't and actually see a fundamental difference in the tenure of the individuals who were living in those two types of properties of about 6 months. And that 6-month difference might not seem like a lot, but it is a lot. And an additional 6 months in terms of quality of life for a very elderly, increasingly frail individual can be very significant for that individual, but it can also be another huge opportunity for cost savings. 6 months in a nursing home setting, for example, if we can avoid that, is again some real savings. So our workhorse program for addressing this need, the need for independent housing opportunities with services, has been our Section 202 supportive housing for the elderly program. It's a program that has been getting implemented out of the federal government now for almost 50 years, and in one way or another has benefited almost 400,000 different units across the country in that period of time. However, it's become increasingly hard for the Congress to appropriate funds for us to continue to support new incremental units. In fact, one of the frustrating parts of this otherwise very successful program is that as a growing inventory of units have been coming online and have been benefiting from long-term operating assistance contracts, the share of properties coming back for renewals has been eating up more and more of the total pot of funds that have been getting appropriated. So in fact, for the last 10 years in particular, what we've seen is that although the Congress has been generally appropriating a similar level of funds, the increment that we have left over to invest in new projects has been diminishing over time. And that increment, frankly, was particularly susceptible in the most recent federal budget as we were going through some very severe cuts in spending that were particularly being placed on the HUD budget. And unfortunately, we actually saw that the increment for new investment under the 202 program completely zeroed out in 2012. We are cautiously optimistic that we can find a little bit of money to put back into the program in our next spending bill. But there are a lot of uncertainties in terms of when that spending bill will actually get passed, and no immediate inclination that this current Congress will do that, at least not until after the election, or perhaps not until the next Congress gets seated. But the good news is, at least the administration has been advocating, the president has been really advocating in his budget request for the next spending bill that we do put some money back into this, and has been arguing that we really do change the program to make it more leveraged and more integrated with other local and state funding sources for affordable housing, and that we really work to make it more targeted so that it is ensuring that we increasingly are serving folks who are most in need of the affordable housing and are most at risk of going institutional settings. And our goal also is to really try and integrate this investment much more with what the state priorities are and the state capacity for overseeing these projects. Because frankly, a lot of the Medicaid investments, Medicaid decisions get made at the state level, not here in Washington, D.C. And then I talked a little bit about our service coordinator program, but this continues to be a place where we would like to be able to invest. We were able to fund some new service coordinator positions in our existing elderly housing this year. We're actually announcing grants on those in the next couple of months. We did get also a small amount of capital this year, which we just put out through a competitive process that allowed some of our existing properties to retrofit their structures to make them easier for elderly folks to live in them, so accessibility features and the like. And a big change in this program, in our assisted living conversion program, actually was that this year, for the first time, we actually did not require, as a condition of receiving the funds, that property owners go through this round is that so long as you could access licensed care in your community, you didn't need to have the property itself go through the licensure process. And that really reflects us keeping pace with much larger changes in the healthcare environment that are increasingly directing the resources that used to be found only in institutional settings now are increasingly available out in the community. And you know, it's really remarkable. I was actually at a presentation yesterday with somebody working in the affordable housing community, designing buildings for a very frail population, affordable housing for a very frail elderly population. And it's remarkable also just to see the ways in which this kind of technology of buildings has really evolving to support this role. And the very modest investment that can go into things. You know, for many years we've really relied a lot on kind of nurse call buttons in some of these buildings that are a great alternative to having somebody pick up the phone and call 911 if they fall over. But increasingly we have these very cost-effective monitoring systems that can actually track what's going on in the unit, so that somebody who really is beginning to have some cognitive problems will be able to quickly receive support. For example, in the middle of the night, the monitoring system determines that she has or he has you know, gone to the bathroom and simply never come back out again. Those kinds of things are increasingly being incorporated even into affordable housing, ways for the elderly residents to be connected to other folks and for a monitoring system to make sure that they are functioning as they normally would. So in conclusion, you know, I would say that the overwhelming goal of on the housing side right now is really focused around preservation. That's where we have the biggest opportunity to have the most impact. And so we're working to try to figure out how we can both preserve the housing that we do have so that we can make sure we don't lose any more units which elderly folks are living in right now. And we're working with our counterparts at HHS to make sure that as those residents age in place, they can access the kind of community-based care that lets them live in those facilities for as long as possible, ideally for as long as they can, as long as they are living, to stay in the community, in the buildings that they've enjoyed so far. But we do continue to invest in new housing, and there are opportunities for building new affordable housing. And when that happens, we're trying to get folks who are funding housing and folks who are building housing to be thoughtful with that scarce resource about making sure that at least a component of that building is in fact targeting elderly who are at risk or are frail, and making explicit partnerships with service providers to serve those folks right in the front end. What otherwise we've seen happening sometime is that an affordable elderly building will open up and everybody who moves in may be in their early 60s and relatively healthy. And there's a missed opportunity there to be serving folks who really have a much more significant need for assistance, which can be provided better in that affordable housing context. And while we don't want to move towards an assisted living environment, while we still envision affordable properties for the elderly serving a range of health levels, and making sure on the front end you are planning for and providing for some degree of services is very, very, very important. And then lastly, you know, you all are planners, obviously, so you know this stuff in a very fundamental way, but location matters. And as we think about folks aging in place, we really do need to think about where we're building housing and making sure that we're making it as easy as possible for new housing to be located in our urban core and infill locations that are convenient to transportation and services that are fundamentally walkable, because isolation becomes one of the reasons why folks often do have to move later in life. And while this matters, you know, while the American with Disabilities Act has provided now for 20 years requirements that larger multifamily buildings be fully accessible and have some adaptable units, we do still see a lot of small structures and single-family and 1 to 4 unit buildings getting built that are really not workable for elderly individuals. And so thinking about how we can encourage universal design aspects and accessibility features, particularly on that walk-up product, I think will be very important as we think about an aging population. Thank you. That's it for me, and I'm going to turn this over to Regina now to continue on, but look forward to your feedback and comments.
Okay, let's see if I can get my screen up. I can't see my screen here.
Regina, we're seeing your screen. You just need to bring up your presentation.
Can you see the presentation?
Yep.
Fantastic. Oh, great. Great. Good afternoon, everyone. Thank you for joining us this afternoon. I am Regina Gray. I am in the Office of Policy Development and Research at HUD, and I'm going to switch gears a little bit and talk about some of the research and maybe some interesting data tools and some initiatives that we have underway, working with not only within HUD but across federal agencies, and some interesting things that we have coming up in the next few years with regard to research on this particular issue and ways that we can work together and collaborate. And I will start, if I can get this to work. Okay, there we go. I will start by talking about some of the previous research that we have done earlier on, maybe 20-plus years old here. And I will not go through this slide, but I'll just start with the very first piece of research that we've had on this issue that Ben mentioned earlier, looking at providing supportive services to the frail elderly in federally assisted housing. This was a very early study in 1989 that we contracted with the Urban Institute here in Washington, D.C. The study looks at looking at estimates of frail elderly in assisted housing who face a significant risk of institutionalization. And we talked earlier, Ben talked earlier about sort of the risks involved in that. It looks at existing state and federal efforts serve this population and possible new approaches to addressing this issue, and provide some very good recommendations for states in terms of how they can be encouraged to provide more supportive services or strategies for implementing new approaches to that. So this is a very important study that if you're interested in taking a look at will give you some earlier insight into this issue on supportive services. This evaluation of the Hope for Elderly Independence demonstration was conducted by Webcast for us at earlier work in 1999. This is the final report from the evaluation of the Hope for Elderly Independence demonstration, which is otherwise known as Hope 4. This is the Hope 4 program that combines HUD Section 8 rental assistance with case management and supportive services for low-income elderly persons, 62 years of age and older, with limitations in 3 or more personal care and home management activities, such as bathing, dressing, and housekeeping. The purpose of the Hope 4 program, which is administered by local public housing agencies, is to expand access to Section 8 rental housing assistance by a frail elderly tenant population and help participants avoid nursing home placement or other restrictive settings when home and community-based options are appropriate. But in addition to the rental assistance, such as vouchers for private market housing, HUD will pay 40% of the supportive services cost. The grantees pay about 50%, and the participants in the program, except for those with very low income, pay about 10%. So this key feature of Hope 4 is the establishment of the service coordinators that Ben mentioned previously. And this is within the Public Housing Authority, who have responsibilities for the design and implementation of an integrated system of case management, personal care, and home management services for the very frail elderly, and these are Section 8 tenants. And so during the first round of the Hope 4 funding, this is in 1993, this was the focus of this evaluation. HUD awarded about 16 grants to public housing authorities, or 16 grants to public housing agencies for demonstration projects ranging from 25 to 150 persons for during a 5-year period. The grants collectively totaled $9.9 million for the supportive services, and the additional $29.6 million for rental assistance. And then the comparison group members differed in several respects. The Hope 4 participants were frailer and a higher percentage received increasing amounts of services. Its disabilities increased appreciatively. So this tells us that more work, at least back then, needed to be done to provide more supportive services for this particular population. So this study, which was conducted in 2005, looks at the construction cost indicators for HUD Section 202-811 programs. This was a study that was conducted in conjunction with the National Association of Home Builders Research Center, actually. And this study reports on the evaluation of the Section 202 and 811 construction and development costs using major industry construction cost indicators. It analyzes the costs associated with accounting and the processing of procedures to obtain information needed to estimate the cost on a per unit basis, square footage, and the elevator, non-elevator basis. It also looks at the accuracy of past indicators that were used to calculate these costs. And it determines that if there is a revision in the current program, the costs are, where costs are needed greatly needed, that we would need more reliable measures for generating indicators of cost. This identifies the most appropriate construction cost index approach for us in the annual update to the program cost limit. So, in other words, this was a way to kind of gauge how much operating costs were going towards the physical structure of the building. And the implication is that if we could find ways to reduce these operation and construction costs, we can then devote more of that to supportive services. This study looks at affordable housing for low and modest income older adults. This was a study that was conducted in 2006 with the Department of Health and Human Services. It examines the potential strategies for meeting long-term care needs of low and modest income seniors. It also looks at the literature on integrating affordable housing and health and supportive services for older adults. And it develops an inventory of federal strategies and programs and brings together several hundred stakeholders from the field of affordable housing and aging services around the country, 4 regions around the country. The study found a wide variety of programs in operation to help individual housing providers do a better job providing certain long-term service care for low and moderate income individuals and families. And now I'm going to talk a little bit about recent studies, maybe within the last 5 or 6 years or so. The first is the Section 202 and 811 operating cost needs. This study was conducted by Staff Associates, and In it, we try to figure out how to calculate operating costs of the Section 202s and 811s due to changes in how the programs are funded. Before 1990, federal housing assistance for the elderly and persons with disabilities, the Section 202 and 811 programs respectively, was provided through a direct loan program for the housing and for the elderly, for handicapped. And that program offered direct loans to nonprofit sponsors. HUD funds the operating costs of housing produced under the Section 202 program for the elderly and the Section 811 program for persons with disabilities through a Project Rental Assistance Contract, or PRAC. Created by the National Affordable Housing Act of 1990, both these programs provide capital advances for nonprofit developers to finance and construct and rehabilitate supportive housing for the elderly and persons with disabilities. Properties have no debt because the PRAC pays the difference between the rental revenues and HUD-approved operating expense levels. And each of the PRACs has a 3-year term and is renewable subject to the availability of federal funds. So going forward, this is going to be another very critical area in which we need to figure out, especially since a lot of these properties are aging, keeping up with operating costs and how to do that in these days of declining federal budget for this. The next most recent study is the Multifamily Property Manager Satisfaction with Service Coordination Survey that was conducted by a few of my colleagues at HUD in 2008. This study evaluates the level of satisfaction among property managers with the provision of service coordination that links residents of HUD-assisted multifamily housing to needed supportive services. Overall, the study finds that a high level of satisfaction with the program, finds a high level of satisfaction with the program, and a strong belief among property managers that service coordination improves resident quality of life overall. The study also finds that service coordination appears to lengthen tenure. The average length of occupancy was 6 months or longer among residents of properties with HUD-funded service coordination as compared with residents of similar developments without service coordination. And then by forestalling or preventing unnecessary institutionalization, service coordination programs help to promote independent living, improve resident quality of life overall, and ultimately save taxpayer dollars. The study explores how residents in developments with service coordinators continue to live independently as compared to residents of developments without formal service coordination. So the role of service coordinators is increasingly important. It's going to be very much so going forward. In 2011, this is one of the most recent studies, enhancing energy efficiency and green building design in Section 202 and Section 811 programs. This was a study that we worked with EPA on. It called for a reduction in energy costs through improved design and operation of HUD-supported projects. This is for the Section 202 and 811 projects. Energy conservation and green building technologies are becoming pretty mainstream in practice and for market rate projects, as well as many of our federally assisted housing stock. To ensure that the momentum continues in the Section 202 and 811 portfolio, HUD moved in fiscal year 2010 to require energy efficiency and water conservation measures and to encourage the use of green building design features in new Section 202 and 811 projects. So this project gives a preliminary evaluation of, or an update on what's going, and how we're moving forward to retrofit these properties with housing stock. And this evaluation was developed to aid sponsors and owners in working with HUD to advance these goals, and specifically to assist in responding to new requirements and incentives to green our housing stock. And then finally, in terms of research, this This study here, conducted by APT in 2011, called The End of Participation in Assisted Housing, What We Can Learn About Aging in Place. This particular report, provides valuable information on the demography of the elderly residents who receive assistance from HUD. It presents the ages at which these residents leave assisted housing and discusses the strategies that could enhance households' ability to live safely and comfortably in HUD-assisted housing for as long as possible without being institutionalized. The report contains a review of recent literature on aging in place and finds that the most commonly cited factor affecting the length of time elderly residents can remain in their homes is access to quality supportive services, but that costly and intensive interventions are not necessarily needed in all cases. And this was a study that was just finished in 2011, and it's a very good study for those who are interested in monitoring the progress of supportive housing. Most seniors that we serve are served through our federal assistance housing stock, Section 202 in particular. But there are a lot of elderly or older Americans who do not live in central cities, instead live in metropolitan areas. And so we were asked in 2008 to work with the Federal Transportation Administration, to look into ways and how we can better coordinate housing and transportation programs locally. This report is important because it comes up with several action items to address affordable housing needs, near transit, mobility needs that will obviously affect older Americans as they continue to age. And because the average American household, we're finding, spends approximately 6% of their income, or 60% of their income, on combined housing and transportation costs, this is a timely report that looks into how we can start to address those costs and reduce them. We probably will be coming up with an updated version of this report, a sort of a follow-up progress report in the next couple of years that marks the progress of where we are now in terms of the local, state, and federal strategies for addressing uncoordinated housing and transportation planning. So look for that in the future. We also have an energy action plan that was published in 2008, for which we are going to be updating in the next year or so. The 2008 plan identifies 23 policy action items to strengthen HUD's commitment to reducing energy consumption and to retrofit HUD housing stock. So we basically are going to continue to provide housing or provide policy and program support for greening existing housing stock. But we also have considerably older stock, HUD housing stock, that also needs attention. So the 2012 report should come out this year. Will begin to address the 23 policy action items and to discuss strategies for continuing to green our stock. The cost of and benefits of going green, this report is going to be coming out this summer. It looks at ways to look at the cost of bringing recent designs up to Energy Star requirements. It also looks at greening affordable housing, and this is particularly important for our own stock. It also demonstrates that the retrofitting of looking at the retrofitting of these older rental housing and bringing them to full compliance will also be cost effective. So look forward to that later on this year. And so let me talk about the current initiatives we have underway, our data tools and other related initiatives that we are currently pursuing. The first, I think Ben mentioned, is the matching of the Medicare and Medicaid data with PIC data. And this is going to be in conjunction with HHS, the Health and Human Services, and the ASPE department in HHS, and basically matching housing data, and the PIC data is our public housing and other assisted housing data with HHS Medicaid, Medicare data to track trends in tenant behavior, also looking at the sort of different special needs of different populations, and et cetera. That is an ongoing effort that that probably is still in its first phase. So I'm sure we're going to be reporting as the effort continues. We're going to be reporting on it, giving an update on that as well. The second initiative is the health conditions of HUD-assisted populations. This involves a recent match of HUD administrative data records with National Health Interview Survey, or NHIS data, to develop estimates of health and wellness conditions. And the goals of this project is to explore descriptive tabulations that will provide a foundation for focused research topics, program interventions, and interagency collaboration in support of HUD's goals, using housing as a platform for improving the quality of life. Our initial goals are to develop nationally representative estimates of the degree of health and wellness among assisted tenants in public housing, housing choice voucher, and project-based Section 8 programs. The descriptive statistical cross-tabulations of the NHIS are intended to estimate the prevalence of major health conditions affecting sample adults and sample children, including obesity, diabetes, asthma, mental health, and developmental disabilities, limitations on daily life activities, and wellness conditions such as smoking, exercise, intensity, and duration. Access will also be measured using 1, 3, and 5 year samples of the entire population. I believe older Americans 62 plus will be included in a lot of those samples. Subsequent analysis will build on the foundation provided by prevalence estimates by using logistic regression or other methods to assess individual and program-related factors, for example, length of tenure, that may explain the risk of adverse outcomes, including neighborhood-based outcomes such as socioeconomic status that will be linked to respondent addresses. Project is exploratory at this juncture. If we're successful in continuing with the matches, the project will lead to an ongoing data series on housing and health that will be made available to HUD and the public. So stay tuned for an update on that. And then finally, our Office of Sustainable Housing and Communities is working closely with other program offices at HUD, including the Office of Policy Development and Research, to develop a housing and transportation affordability index tool. This will be an analytic tool that will estimate the combined true nature cost of housing and transportation. And the ideal goal is to develop this tool that could be used by HUD program officers in calculating redefining and assessing the true nature of affordability in HUD-assisted communities. There's also talk about developing a separate tool that could be used by the public in general to make better decisions, better informed decisions on where they live in relation to affordable housing and access to transportation and other community amenities, including health care provider and other services provided by the community, jobs as well. I want to talk just a little bit, or mention just a little bit about the Sustainable Communities Research Grant Program that is out of the Office of Policy Development and Research. The purpose of this program is to support the research community, building on evidence-based research in various areas of sustainability. Fiscal year 10 was the first time that we offered this competitive grant program. The total was it's $2.5 million, $1.5 which came from FY09 appropriations, and $1 million from our Office of Sustainable Housing and Communities. And for that round of research grants, we focused mainly on expanding affordable housing and choice, improving access to transportation, improving access to community assets through effective transportation, coordinated housing and transportation, healthy community design, and green and energy efficient housing, building and housing standard practices. And then there was a miscellaneous category for which we received a lot of proposals looking at active aging, aging in place, and other areas related to it. There were 6 award recipients that were announced last September, one of which is the University of Maryland, which will be looking at the walkability of neighborhoods in which Medicaid and Medicare recipients are situated in, and the quality of life that they have based on physical environment. And this is looking at Miami-Dade Medicaid, Medicare beneficiaries. So that report we expect to come out sometime early next year. So that is a grant program that we hope to offer in FY13 as well. I just want to mention some of the efforts to continue to support our federal partners at DOT and EPA. The Office of Sustainable Housing and Communities serves as the lead representative for the HUD DOT EPA Partnership for Sustainable Communities, and PDNR, or Policy Development and Research here at HUD, is sort of the advisors for that. And the Office of Sustainable Housing and Communities, as you might know, sponsored 2 planning grants. One is the Regional Planning Grant Program, and the other is the Community Challenge Grant Program. Both planning grant competitions really focus on the coordination of housing, transportation, health, and other areas of focus, areas of sustainability, livability, for communities who are seeking to improve the coordinated activities at the local and state level and regional level as well. PDNR was an early participant in the intra-agency working groups. I mentioned before the Federal Transit Administration is working with HUD on various affordable housing and transportation issues, of which will have great implications for an aging population. HUD is also the lead in efforts for development sustainability for performance measures and aligning federal planning requirements. We're doing a lot of work to address internal regulations or standards at the federal level that could create barriers for affordable housing, and actually and how to address those barriers and reduce them. And then we work with other program offices within HUD, our Office of Community Planning and Development, our Office of Public and Indian Housing, and all of these to address certain sustainability issues or livability issues affecting communities at large. In the future, there's several things that are going to be going on, several resources I just want to point out as well. There is going to be a major evaluation of the Office of Sustainable Housing and Communities Regional Planning and Community Challenge Grant Programs. And those 2 programs will undergo a 3-year program evaluation. We hope to start the evaluation sometime next year. If not, some parts of it are already underway. There's also going to be there also is an unveiling of the Sustainable Communities Clearinghouse. This was recently introduced, this website to share best practices on local and regional sustainability efforts in partnership with not only PDNR, I have here PDNR, but it's the Office of Sustainable Housing and Communities, and also other program offices. This website will be available in conjunction with our Regulatory Barriers Clearinghouse, and you should be able to go there and see a lot of our best practices in sustainable research. Some of that will contain some issues related to aging in place. Economic impacts, sustainable communities. These are strategies. We are going to be developing a research paper soon that assesses the impact of infrastructure investments of job creation, economics, or regional economics, and the creation and preservation of affordable housing. This is going to be looking more towards how the built environment impacts certain outcomes, health-wise, education, and other types of indices and quality of life indices in general. And then we're developing a 5-year research plan for HUD in which we're going to engage other federal agencies as well as stakeholder groups. APA, I'm sure, will be reaching out to you to identify a set of research priorities that we should be addressing over the next 5 years. And as we've been talking to a lot of our sister agencies and organizations, AARP, for instance, the aging in place issue has come up increasingly as something that HUD should be doing a lot more in terms of research that it conducts. Some stakeholder and partner outreach, these are just some examples of what we've been doing. We've been engaging the public a great deal more than we have in the past to help us set our research agenda. We've heard a lot from the broader public about many issues that we should be addressing, livability issues, aging, etc., built environment. There's also other things that we've been engaged in. We held a symposium with Virginia Tech a couple of years ago that looks at housing and transportation coordinated policies or integrated strategies. Shrinking cities, which is an initiative that I think was still in existence, but looking how cities can, we can address the issues related to the housing and economic crises that impacted cities and regions, and then looking at how we can continue to develop strategies to green our housing stock and create more options for low and moderate income families in greening affordable housing. We've participated in stakeholder initiatives, conferences, and meetings on this. There's the What Works collaborative that comes out of the Urban Institute and the joint collaborative with Urban Institute and the Brookings Institute to address many different livability issues. There are a lot of aging issues that came up in our discussions, so we'll be moving forward in that. We've been working with university sustainability centers all over the country to identify issues of import that we should be, that should continue to receive some focus. And then we are continuing to come up with ideas for collaborating with our partner agencies, including energy, agriculture, HHS, of course, DOT, and other education, etc. I just want to mention a couple of the data tools and information dissemination portals that we have available. PDNR is working with other federal agencies to improve data infrastructure. I mentioned and Ben mentioned data matching with other agencies, for instance. So we are continuing to improve internally our data infrastructure, but also working with other agencies to do joint collaborative data improvement initiatives. We are in the pursuit currently of developing new GIS tools and analytics. We have made an investment in tools like the Esri Business and Community Analyst, for instance, to aid in our research. We are strengthening information sharing with researchers, practitioners, our other federal agencies, and state and local regional offices. And we're doing a lot more of that than we have in the past. So the more that we can improve our data at the state level, the better that we can come up with great ways of pursuing research and demonstration projects. And then other innovative tools for consumers. I mentioned before the Housing and Transportation Affordability Index that's underway with our Office of Sustainable Housing and Communities. But there's also a Sustainable Communities Code-a-thon, and there is a few other initiatives going on that that we're trying to engage the public on in terms of helping us make better decisions at the federal level, but also helping us to address issues related to the built environment, physical environment, built environment impacts on quality of life. In conclusion, I know that this is a discussion that we're having today on federal tools for aging and livable communities, but we try to emphasize that it's going to take government, not just at the federal level, but at the regional, state, and local levels, a bit of advocacy from groups that have a passion for this issue, research, and also private industry to get us where we need to be. So I did want to make that point. And I also wanted to leave you with a list of HUD resources. All of the studies that I mentioned earlier are available on our HUD user website, which is the portal for the Office of Policy and Development. And this is where you can get access to all of our research in full, access our HUD databases. They're there also at huduser.org, but there's the complete address. The Office of Sustainable Housing and Communities, that we work very closely with on livability issues. I've put their portal there. A regulatory barriers clearinghouse, which looks at barriers to affordable housing, preservation, is there. There is a new Sustainable Communities Research Highlights, which focuses on best practices that I mentioned earlier. And then there's Evidence Matters, which provides information on any of our demonstrations and evaluations that we've conducted in recent years, but definitely there's some information on past evaluations as well. A few acknowledgments here, folks will help me with this presentation. And then I just wanted to thank everybody again for spending some time with us today to talk about this very important issue. And I think I'm going to turn it back over to Ramona.
All right, so we're going to start getting into the questions. So Ramona's putting up a list of the contact information for Ben and Regina, so you guys can feel free to jot that down. Our first question comes in from Heather. How are transportation costs considered in providing supportive housing to keep seniors out of nursing homes? She's often had to review applications to fund vans to transport these seniors long distances from their supportive housing because transportation costs weren't considered in choosing the location. Of course, this is a QOL issue as well as a financial one.
So this is Ben. I'll just respond by saying that it's a great question, and that I think generally folks have not done a good enough job in terms of trying to actually calculate this. And I mean, Regina, you can talk a little bit about like the H+T index maybe, but in practice, what I tend to see, and certainly what we've done here on the CO2 program in years past, is that in a competitive funding process, we explicitly give points depending on the proposed location's proximity to transit lines, you know, weighted by the frequency of that transit service. And I think also when you go and you look at state competitive processes under qualified allocation plans for low-income housing tax credits, for example, and the 9% credits, you see many, many, many states that have explicit criteria incentivizing applications or rewarding applications as opposed to build near transit. But there's certainly more that could be done there. Many states don't have that still, and probably should. But I do think that's a very important screen to be looking at as you're citing new projects.
Thank you for the question. It's a very important one that we've actually had a lot of discussion about. The Housing and Transportation Affordability Index tool is one of the approaches that we've been grappling with as a way to address that issue. It's difficult because transportation should encompass a wide variety of like sort of mode of transportation. So not just transit, for instance, but bus routes and that kind of thing. So our discussions with the Federal Transit Administration, in those discussions, we've tried to come up with better metrics, I suppose, for transportation, but also for affordable housing. Are we using the right sort of metrics in how we define affordable housing? Should those metrics be reconsidered? What we're happy with is that we're having unprecedented conversations and collaborations with other federal agencies that we hadn't had in the past on this very issue, in terms of looking at their programs, DOT in particular, their New Start program, Small Starts program in particular, that is now looking at affordable housing or including affordable housing principles in their funding their funding notices, for instance, or looking at sort of coordinating affordable housing or coordinating housing and transportation as a requirement, I suppose, or at least giving extra points for communities who are striving to address coordinated planning or coordinated activities at the local and regional level.
All right, great. Our next question comes in from Donna. It seems that the federal policies are geared towards large multifamily development projects. Is there any discussion about working with single-family homeowners to do retrofit to their homes and coordinate with healthcare services so that people can age in place even if they own their own home?
A few years ago, we looked at the possibility of offering energy efficiency mortgages, and this obviously is for single family, but decided that there needed to be a lot more buy-in on the lender side, and perhaps the program would have been good in theory. Done several pilots back in the mid-90s, where we basically track the progress of energy efficiency mortgages in 5 states, for instance, how many people were using them, whether or not it was cost effective, whether or not, what was the foreclosure, or if there were delinquency involved in these. So these would be second mortgages, obviously. Then what were the implications of that? But we we don't have an energy efficiency mortgage that could be used to do, for individuals to do retrofitting. But I think that there's been some discussion of some other approaches. I'm just not familiar with a lot of those, and maybe Ben might be, but
there is the Power Saver mortgage. It's a pilot offered by the Federal Housing Administration, which provides $25,000 basically second mortgages, 20-year term second mortgages to make energy improvements. And you can basically get that money and use that to make a set of improvements to the property that are incorporate eligible improvements to improve the efficiency of the building. But in terms of retrofits, like on accessibility, for accessibility purposes, I think that there is often some funds to do that. Some local jurisdictions also provide grants, often from home or CDBG funds. And I think this is obviously very important, because so much of the stock, in fact, even on the renter side, I think the majority of rentals in this country are actually in that 1 to 4 unit space. Most renters, in fact, don't actually occupy the large multifamily structures. They're actually more likely to be living in the small structures.
Okay, great. Our next question, this is for Ben. Are there resources to help small community groups to put together senior housing development projects, and in particular any pro forma templates for the financials and cash flow analysis, both utilizing LIHTC and debt payments?
So Yeah, I mean the primary source of capital for construction of new housing, probably housing, is going to be through the low-income housing tax credit program, or through home dollars that are going to be administered at the state and local level. So you definitely want to start by just looking at contacting your state housing finance agency or your state community development agency or your local housing department to assess what funds that they have available for grants or tax credit allocations. And in terms of beginning to put those applications together for small groups, it definitely makes sense to find a consultant. There are a lot of consultants who specialize in structuring these kinds of transactions with tax credits and the like. And there are training resources out there that I encourage folks to look at. Enterprise and LISC are both two organizations that provide a lot of trainings in this space. And the, gosh, well, I'm blanking on the name, the Affordable Housing Development Council, I think, is another organization that does a lot of trainings. Regina, do you have any suggestions on that?
It's a good question. I'm not really familiar with it's something that I could look more into. I think that there might be a few of my colleagues who are looking deeper into that issue. I don't know how we can follow up, but it'd be great if we could.
All right, our next question comes in from Heather. How can we reach out to nonprofit human service providers to improve their understanding of land use and pedestrian accessibility?
Yeah, that's a good question. I bet that the folks on this call who could answer better than Regina or I could, to be honest. I mean, I think a lot of this is just grassroots education. I would think that the APA could be helpful in terms of your local chapter working to facilitate forums. I think it is important to look at who the kind of possible sponsors would be for those kinds of forum or colloquia or trainings or publications. You may have some allies within your local governments or state governments who are worried about thinking about these issues already. There may be local foundations. There may be universities that also have connections or channels with this stuff. I really think that answer is going to depend on the ground with who's already working on these issues and harnessing that effort.
Yeah, I'm sorry. I was going to say that this is a question that also if you can believe it, we're grappling with transportation. The role of the MPO is going to be important, or whatever the local or regional the regional entity or transportation entity. And we know that in some areas the MPO has a lot of influence on the planning process, and others that don't. This is a coordination. This is a coordination issue, and where we can get better coordination, between the local region or regional transportation authority or the MPO. I think that's partly where it's gonna come from. But somehow I think Dennis is right. It's just gonna have to be a grassroots, bottom-up kind of approach to this to bring this issue to the forefront. It is something that we are talking about, though.
You should also reach out to for elderly services, definitely reach out to your area agency on aging. There are aging agencies that exist all across the country that do administer funds for elderly services and have all sorts of relationships. And then, like I said, also your local jurisdiction that's administering home dollars or CDBG dollars probably has relationships there as well.
Okay, our next question comes in from Carrie. What advice do you have for rural communities that are served only by private transportation services who want to provide their aging populations with affordable elderly housing and transportation?
I'm not sure I quite understood that question. Is it the question, rural communities where you don't have access to public transportation, how do you provide them with access to transportation? Is that kind of the question?
Rural communities that are only served by private transportation services but want to provide affordable elderly housing / transportation with no public transportation yet.
Yeah.
Yeah.
Well, I think, certainly even in small towns, you're going to have some town center, right? And, to the extent that you can locate your projects in places that are walkable, that will help a lot. And, the other key is going to be having service providers that can deliver directly to the property, so that you have somebody you can check in, do a Meals on Wheels, use the figure out ways to really use the internet to deliver some service content, or even groceries, right? Again, I was seeing a property a couple days ago where they have these little healthcare kiosks, for example. This is for a large building, but still, this stuff can be done now where you actually can have somebody basically piped in over basically like a Skype kind of interface that can do kind of nurse level checkups with individuals remotely to assess their condition and give them some advice on service opportunities.
Okay, and adding on to this, would that lack of public transportation prohibit or limit affordable elderly housing?
This is a chicken and egg argument. If there's and this is another issue, if there's existing affordable housing, let's say it's a LIHTC, low-income housing tax credit property, or Section 8 property that's reaching its the end of its contract period, and it's expiring near transit, and so you've got an issue of what's going to happen to that affordable housing and how you're going to address sort of this issue with now that folks face the possibility of being displaced, and how that's going to impact the sort of mobility issue. I'm not really sure if there is existing transit available but no affordable housing. That seems to be a problem that we confront a little bit more. That there seems to be more of an issue where there is transportation, but building affordable housing may not be feasible for a builder who's, we're finding that the land values are actually increased, so building affordable housing may actually not be feasible for a builder who is committed to building affordable housing unless they embed affordable housing units in the development, and then provide access that way. Senior housing, I'm just not clear about. I would assume that it would be sort of the same issue related issue.
And let me just say that although having access to public transportation is helpful to age in place, is by no means necessary. And I'm actually looking at the Center for Housing Policies, their recent report, Housing and Aging Population. They tabulated some of the American Housing Survey data for 2009. What they found is that 70% of renters who are 65 or older report having access to public transportation, but fewer than half of homeowners. So a lot of people don't have access, but they're still aging in place one way or another. And then actually more remarkable to me is that even though a lot of people today, elderly people today, have access to transportation, they're actually not using it. So only, according to the 2009 data, only 17% of all elderly households with ready access to transit are actually using it. So again, this is a nice thing to have, but by no means essential. There are other ways to deliver the services. There are other ways to access the services and the basic amenities. The concern, I think, is really just isolation. And I think this is particularly pronounced where you have elderly people living in single-family homes that are really cut off from other social engagement activities. They don't have access to service connection. They don't have a way to connect with other people and get care.
I agree with that. We're finding that that a lot of the older the older neighborhoods, the older suburbs, and the exurbs is where a lot of aging population are situated, and then it's much more of an issue of driving, in these older neighborhoods, access to public amenities that maybe have left the area and gone to either another suburban central business district, or the central city, or in other words, inaccessible. So that the issue of driving, having access to car, having access to public amenities, but also like paratransit, if it's a frail elderly person who can't drive but needs to get to a clinic or a hospital, what have you, that seems to be sort of the bigger issue other than public transportation.
All right, great. Well, that'll be the last question for today, and we'll be ending our session in a moment, so I'm going to switch it over back. I have a... Oh, go ahead.
Thanks for a second. So earlier question asked about resources for getting training on affordable housing development and finance. A great resource to look at is the nationaldevelopmentcouncil.org. Is a national organization that provides excellent training. So I encourage folks to check it out. nationaldevelopmentcouncil.org.
Okay, and then also if anybody has any questions that they want to follow up with Ben or Regina, their emails are listed right here, so you can take a moment and jot them down. And I'll be switching back over to my screen in a moment, and I'll go over how to log your CM credits for attending today's event. So thanks again to Ben and Regina, and also Ramona for organizing this webcast today.
Thank you very much. Thanks for having us.
Thank you. Have a great weekend, everybody.
Thanks.
The organizer has ended the session, and this call will be disconnected.